Hey everyone, good morning. This is Dr. David Midoff at El Paso Manual Physical Therapy, and I wanted to talk to you all about shoulder injuries today. A common question that I get is, how do you fix a rotator cuff tear? Or my shoulder hurts, what should I do about it? What stretch should I do? What exercises should I do? Let me just make a little adjustment here. And one of the most common exercises that I see people do, because they Google it, of course, or maybe somebody recommended it, a medical professional like a physical therapist or someone else, and they'll get a band kind of like this, and they'll hold it and start to do this bit right here. And you'll feel a burn in the rotator cuff area, and certainly this exercise does train the rotator cuff muscles or strengthen them. But I think it's kind of missing the point in a lot of the cases that I see. People that have stuff like rotator cuff tears, shoulder impingement, shoulder labral issues, injuries, bursitis is another one, shoulder bursitis. They're focused on structures, on tissues that are right here. Another one is biceps tendinopathy or tendinitis, the bicep tendon that runs up into the shoulder. That's just kind of a choke point, if you will, in the shoulder. But it's not the main place to be fixing the issue. What we find is actually many people need shoulder blade strengthening. So if you look at the skeleton here, here's the ball and socket joint, and you have 4 rotator cuff muscles, one big one right here, there's one on the top, and then if we look at the other one, there's one on the front of the shoulder blade right here, and another little one that comes in from the back, and they all kind of hold onto the ball of the socket, the ball of the ball and socket joint, and they pull it into the socket. Now, if we look back at the shoulder blade, can you see how this is kind of a separate bone? And with this, the skeleton doesn't allow you to see as it moves around a whole lot. The shoulder blade can move around. I mean, if you just think of your shoulders, you can shrug, you can roll them forward, you can roll them back. They actually upward rotate. They can come up when you reach up. There's a ton of movement that happens at that shoulder blade. And if that movement is not controlled very well, then this is what starts to become injured. And so doing those rotator cuff exercises where you're rotating in and out like this is just training the muscles here, and you really might get some short-lived relief. But if you never train the muscles to help to stabilize the shoulder blade, then it's not going to last long, and that's what needs to happen so that you're not constantly running into shoulder problems. Now, I hang around a lot of CrossFitters and powerlifters, and because I love doing that stuff, and so as a result, I hear a lot of the problems that they have. And one of the most common things that I hear people use to treat their shoulder problems is rest. They're doing a lot of overhead motions, like say in CrossFit, they're doing thrusters, push press, strict press, handstands. It's also an overhead motion. And then they'll say, oh, you know what, my shoulder's kind of hurting me. I'm going to take a week or 2 off. Well, it's hurting because the tissues have become inflamed. All those tissues I mentioned earlier, the labrum, the rotator cuff tendons themselves, the bicep tendon, or the bursa, it's all become inflamed. And so you feel it. And maybe if you lay on it, like at night when you go to sleep, it hurts more. Well, just like if you cut your skin, it's going to hurt. And it takes some time to heal. You give it some time, and it heals up, and you're good to go. Your skin is fine, and it's not going to hurt anymore. Well, if you give the injured area, the irritated area, some time, the inflammation will go down, and you'll feel good again. But then you go back into your exercise, and if you're not strong enough to move correctly, like I'm going back to the shoulder blade. If this shoulder blade isn't moving correctly, whenever you're doing that overhead lift, then you're going to run into the same irritation in the shoulder joint and be stuck in the same cycle over and over again. So what we teach all our clients to do is learn how to move appropriately so that they can do it wherever they're at, whenever they want to, and there's no limitations on the exercises that they decide to do. They know how to move it. So here's a basic concept that I teach my clients in order to have them learn how to use their shoulder blade effectively. I call this rule of the hand. So wherever your hand goes, your shoulder blade should follow it. So let's say you're reaching forward. Sorry about that technical error. All right, we're good. Let's say you're reaching forward and like say you're doing a bench press or you're doing some sort of punching motion or forward motion. Your hand's going forward, so your shoulder blades should roll forward off your body a little bit. You should kind of go like that. So when you're bench pressing, you should roll those shoulders forward. Roll the hand. Wherever the hands go, the shoulder blades follow. When you're coming towards your body or behind your body, your shoulder blades should pinch backwards. Now, think of a push-up or a bench press. Whenever you're pushing the bar forward or you're pushing yourself away from the ground, your shoulders should kind of round forward for a moment. That's to get that ball. If you think of the ball and socket joint, it's going to move it like that, so it's not straining the tissues on the edge of the joint, so it's not taking into an extreme motion. You need to set those shoulder blades forward. And then same thing when you're bringing the bar down, or you're coming down on the push-up, bringing your body down, your shoulder blades should be pinching back a little bit. Then the same applies for whenever you're reaching up overhead. So doing any sort of overhead lift, an overhead press, thruster, anything where you're pushing up overhead. Handstand is another one. As your hands come up, your shoulder blades should also come up. A lot of people don't do that. They reach up to right here. Can you see the space between my arms and my head? It should be more like that, because now I've shrugged my shoulders, I've moved my shoulder blades up, they've rotated up. And if you think of the socket here in the ball, as you're coming up like that, whenever you shrug the shoulder up, the socket comes up right there. Now we are bipedal animals, if you will. We stand on 2 feet, we're upright, we're not walking on 4 legs like a horse or a dog or something like that. So our body takes advantage of stacking. We stack our joints because it works efficient so that we can fight gravity. Now, if you think of the spine, it's stacked up on our legs and all that, but whenever you're reaching up overhead, by moving that shoulder blade up, you put all the weight going through your arm stacked on top of that socket. But if your shoulder's down here, it's at an angle, the socket's at an angle, and now it's stressing out all the rotator cuff tendons and all the bursa, the labrum. It's putting extra stresses on those. So it's important that you follow the rule of the hand and you shrug it up all the way whenever you're coming up overhead. You don't have to hold it there. You know, if you're doing a thruster, I did thrusters this morning, for example. Every time I went up, I made sure to push my shoulders up for a moment. It's almost like you're trying to hit the sides of your head or your ears with your shoulders here, your deltoid muscles. So if you follow that principle, you should be able to prevent a lot of problems from happening, and you should be able to avoid from constantly irritating your shoulders. If you are still having issues, there may be some specific things to look at, like you might have some restriction in your joint, or there may be some severe muscle imbalance. If you can't quite get up all the way, sometimes the collarbone joints might get stuck, and there's stuff in physical therapy that we can do to make sure that you're not being stopped by that. But being able to reach up overhead effectively is a critical thing that everybody should be able to do. I really don't think that you should avoid it. I know if you've had a rotator cuff problem, you might be avoiding it, but you want to make sure that you learn how to move into it safely, because having strength in all those muscles that control your shoulder blade is so important to move forward in life. People start getting the aches and pains up here, and it starts to affect your neck. So long term, it's really healthy for you to be able to do that effectively. So y'all please comment, ask questions. I'll be typing my answers, and if there's any special questions you want to private message me on, I welcome that as well. Thank you guys, and have a great day. Hey everyone.